Hi, I'm Dr. Terry Wood, and I'm visiting with you from my clinic, Mustang Veterinary Hospital, Mustang, Oklahoma. And today we're going to talk a little bit about allergies. Allergies represent probably about 90% of what I see on a day in, day out basis. It's a huge problem, and so it's been my life's goal to try to bring together Eastern holistic methods along with some Western methods to try to do what's best for your pet. It's been a very challenging subject because when I was in school, which was longer than I care to admit ago, what happened is we were basically told allergies are a steroid deficiency. You give them enough shots, enough pills, you're going to fix it, they're symptom-free. And in Western medicine, if you relieve the symptoms, they consider that a cure. You know, the pets told me that wasn't a cure, and so that's what's driven me to try to find out a lot of things of what can I do to do a better job of being a cure with this. So what we'll do is, just as a very brief overview, and for those that have more interest, I will have a free ebook download that you'll find links to whatever means you're watching this on, and it will give some very specific details on what the procedures and things that I do, products I use, products I don't use. For a general overview, what we have to remember is that in dogs anyway, they get allergies just like we do, but instead of the upper respiratory stuff that I get, the sinus and all that kind of stuff, the drainage, what they get, it's usually skin problems. It's one or all three things. They dig at their ears, which leads to chronic ear infections, they lick and chew their feet, and they scoot their butt on the floor, the classic boot scoot boogie. With cats, they tend to just scratch and dig, and they can cause some pretty significant sores when they're doing that. It can be a very complicated subject. To basically make it very simple, there's only three main causes of allergies. One, if it's a flea allergy, it's real easy to see because it's the back third of the pet. You can see all these nasty lesions. Front 2/3 of the pet, at least early in the progression, is still pretty good. If you don't do anything, it'll get bad too. But that's always easy to see. When they walk in, I see the back third of the pet. The owner says he's digging, scratching here. It's always fleas. We have some very safe ways to take care of those. The second thing is the food, and that's a huge issue. And the way that we distinguish if it's a food allergy is that it's every day, all year long. The important point is that about 60 to 80% of the immune system is in the gut. And if you're eating a food, if the pet's eating a food they're allergic to, a lot of things are going to happen and they're all bad. We don't want to go there. And it's so simple. It goes back to the father of modern medicine, Hippocrates. He said, let medicine be thy food and let food be thy medicine. Well, he was right. So that's a huge thing, and we have lots of things to talk about on that. The third thing is your atopic or seasonal allergies. Now here in Oklahoma, the springtime can be bad, and then ragweed in the fall. We can set these times, we know when it's going to happen. But the main distinguishing factor of that is that there are days, weeks, and months where the pet is symptom-free, not having a problem. And then usually about the time you start sneezing, your pet starts scratching. And again, there's a lot of different ways we can combat that are safe. I try to do integrative things. I do some Western stuff. Try to do a lot of holistic solutions if we can do that. But it's a big subject, and again, just want to remind you, there'll be links either to my website at the bottom of the page that you can get the free download on allergies, and I think you'll find it very helpful. Thanks.